You go for your yearly checkup. The doctor looks at your blood test results, gives you a reassuring smile, and says, "Everything looks great. All your numbers are perfectly normal." You feel a wave of relief. You're healthy, right? But what if that feeling of security is a complete illusion? What if, right now, deep inside your arteries, your brain, and your organs, a silent disease is taking root? A disease that won't show up on your normal blood tests for another 5, maybe 10 years. By then, it's not an early warning anymore. It's a full-blown crisis. This isn't a scare tactic. This is the terrifying reality for millions of people who believe they are healthy because their standard lab work says so. They do everything right, but they are blindsided by a sudden heart attack, a devastating stroke, or a life-altering diagnosis that seemingly came out of nowhere. But it didn't come out of nowhere. The clues were there all along. They just weren't being looked for. Today, I'm going to reveal the 5 critical blood tests that your doctor is probably not ordering. These aren't experimental, fringe science tests. These are deeply researched markers that can predict disease years, even decades, in advance. Knowing about them and asking for them could literally be the most important health decision you ever make. Stick with me, because the last one is a common test that almost everyone gets, but it's being read completely wrong, and it's masking a silent epidemic. So why do routine labs miss so much? Think of it like this. A standard cholesterol panel is like looking at a highway from a distance and saying, "The traffic looks okay." But what you really need to know is exactly how many cars are on that road, what kind of cars they are, and how fast they're going. That's what these advanced tests do. They don't wait for the traffic jam, the heart attack, the stroke, to tell you there's a problem. They spot the danger when there are just a few too many cars on the road, years before the pileup. Let's start with the first one, and it's a big one. Lipoprotein A, or LPA for short. Have you ever heard stories of a perfectly fit, 40-year-old marathon runner who eats salads every day and suddenly drops dead from a massive heart attack? The hidden culprit is often LPA. This is a genetic marker. You get it from your parents, and it doesn't change much throughout your life. Next up, test number 2, ApoB, which stands for apolipoprotein B. For decades, we've been told to watch our LDL, the bad cholesterol. But LDL is an estimate, and it's an incomplete picture. ApoB is the real deal. Imagine every single particle in your blood that can cause plaque, all the dangerous, artery-clogging particles, has a little tag on it. That tag is ApoB. So, by measuring ApoB, we are directly counting the total number of particles that are trying to burrow into your artery walls and cause a blockage. This is far more accurate than LDL, especially if you have issues like insulin resistance, belly fat, or high triglycerides. 2 people can have the exact same, normal LDL level, but one could have a huge number of small, dense, highly dangerous particles, while the other has fewer, larger, fluffier particles. Their risk is completely different, but a standard test would call them both fine. For optimal prevention, you want your ApoB number to be low, ideally under 60 mg/dL. It's the most accurate predictor of your future heart attack risk we have. Now for number 3, a test that looks at the health of your brain and blood vessels, homocysteine. Think of high homocysteine as a kind of toxic smoke filling your body. It irritates the lining of your blood vessels, making them prone to damage and clotting. It's a major independent risk factor for strokes, blood clots, and even dementia and Alzheimer's disease. So what causes it to be high? It's almost always a sign of a deficiency in key B vitamins, specifically B6, folate B9, and B12. Your body needs these vitamins to clear homocysteine out. A high level can also point to a common genetic variation called MTHFR, which makes it harder for your body to process these vitamins effectively. The good news is, if your homocysteine is high, it's often incredibly easy to fix with the right kind of B vitamin supplementation. But you can't fix a problem you don't know exists. An ideal level is below 10 mmol. Getting this checked is a simple, powerful way to protect your vascular and brain health for decades to come. The 4th test is one you might have heard of in a different context: uric acid. Most people associate uric acid with gout, that painful condition in the big toe. But that's just the tip of the iceberg. Uric acid is one of the most powerful and earliest warning signs of metabolic dysfunction. Long before your blood sugar starts to rise, your uric acid will often creep up. It's a red flag for developing insulin resistance, which is the root cause of prediabetes and type 2 diabetes. High uric acid is also strongly linked to high blood pressure, fatty liver disease, and cardiovascular disease. It's like the canary in the coal mine for your metabolism. Decades ago, a normal uric acid level was considered to be around 3 or 4. Today, the normal range in labs can go up to 7 or 8. This is a classic example of shifting baselines, where we normalize what is actually a state of disease. For optimal health, you want your uric acid to be below 5.5 ppm/dl. If it's higher, it's a huge signal to take a serious look at your sugar and fructose intake. Finally, the fifth critical test, which is all about your kidneys, cystatin C. For years, the gold standard for checking kidney function has been a test called creatinine. The problem is, creatinine is deeply flawed. It's a waste product from muscle, so your level is heavily influenced by how much muscle mass you have. A bodybuilder could have a high creatinine level but perfect kidneys. An frail elderly person could have a normal creatinine level but be in the early stages of kidney failure. Dehydration can also throw it off. Cystatin C, on the other hand, is produced by all cells in your body at a constant rate and is a far more stable and accurate marker of how well your kidneys are actually filtering your blood. It can detect a decline in kidney function years before creatinine does. Kidney disease is another one of those silent killers. You can lose up to 50% of your kidney function before you feel a single symptom. The best practice today is not to replace creatinine, but to order it alongside cystatin C. The combination of the two gives a truly accurate picture of your kidney health, giving you years of warning to make changes and protect these vital organs. Okay, so we've covered the 5 tests you need to ask for: LPA, ApoB, homocysteine, uric acid, and cystatin C. But now for the bonus section, the one I promised you. This is about a test you probably already get, but it's being misinterpreted on a massive scale. I'm talking about your ALT, a liver enzyme test. Your doctor will tell you that a normal ALT is anything up to 40. This is dangerously outdated. That normal range was created by studying a population that was already sick. We now know that a truly healthy, optimal liver has a much lower ALT. For men, it should be under 25, and for women, it's ideally under 19. If your ALT is in the 30s or even the high 20s, and your doctor says it's normal, they are missing a huge flashing red light. This is one of the earliest signs of fatty liver disease, a condition now affecting 1 in 3 adults. Fatty liver isn't just about your liver, it's a driver of insulin resistance, heart disease, and systemic inflammation. A normal ALT is not a healthy ALT. This single shift in perspective can reframe your entire health picture. So what's the takeaway from all this? The message is clear. Don't wait for symptoms. Symptoms are the end game. When you finally feel chest pain, or have trouble remembering things, or feel utterly exhausted, the disease process is already years, maybe decades, down the road. You are years behind. The old model of wait for a problem and then treat it is broken. The future of medicine and your personal health is about prediction and prevention. It's about being proactive, not reactive. You have to be your own health advocate. Take this list of tests to your doctor, have a conversation. Insist on getting a clearer picture of what's truly happening inside your body. It might be the most important conversation you ever have. Thank you so much for watching. If you found this information valuable and want more life-changing, science-based health content to help you take control of your future, make sure you hit that subscribe button. We release new videos every single week. Stay curious, stay proactive, and I'll see you in the next video.